and welcome to this session titled Fighting the Next Health Crisis, Curing Cancer. My name is Martina Buchal, and I am delighted to be here with you today to give you a brief introduction of who I am and what brings me to the ChangeNOW virtual stage as the moderator for you. I am a Czech-Canadian award-winning speaker and leadership development coach, the founder of Start Within, as well as a lecturer at one of France's top business schools, teaching a course titled Visionary Leadership. This, for me, is something that I absolutely adore doing. It's a chance for me to work with some of France's top minds to help them see themselves as change agents and potential leaders for making the world a better place. So I, like many of the speakers here today, am passionate about making a positive difference in the world for everyone through both big and small actions. As such, I couldn't be more excited and honored to be here today to present to you the speakers that we have and to moderate an important discussion on a subject that is deeply linked to the state of the world and the health of its citizens, the topic of fighting cancer. You see, a conference like ChangeNOW would not really be complete without addressing this particular subject. When we look at some of the most pressing issues of our times, like those identified by the United Nations Sustainable Development Goals, for example, it's really important to see that human health, wellness, and longevity are really central to creating a positive impact in the world and a positive state of the world. Therefore, since cancer is so wide-ranging and far-reaching, a discussion about changing the world for the better would not be complete unless we talked about how to understand, detect, and treat cancer. Today, you'll hear from several speakers who have taken this often difficult and emotional subject and really took it into their own hands to find innovative solutions to ensuring that cancer becomes a word that is far less scary because we learn about it, because we know about it, because we talk about it, and because we treat it. Having said that, I am so ready to introduce you to our keynote speaker today. Fabian Bolin is someone who has an infectious smile, a fantastic personality, and somebody you certainly want to be around. He, like many others, though, wasn't expecting to become so intimate with the subject matter of today's discussion. But at the age of 28, cancer came knocking on his door, and he had a choice of what to do when brought to that call. His story is one that I'm sure will inspire you and many others, as it teaches us the power of education and resilience, strength and positivity, and most of all, I would say, community through our most challenging times in our experience here on Earth as humans. I invite you all to listen deeply to his personal story and to really understand the impact of the work that him, his co-founder, and their team at War on Cancer, the organization that he founded or co-founded, are doing. War on Cancer is a digital support tool for everyone who is battling cancer or knows somebody who is battling cancer. Notably, one thing you'll want to know about Fabian is that since he started his work, he has won multiple awards, including Journalist of the Year in 2015 for sharing his cancer story. Also, Swedish Super Talent in 2018. He was ranked #1 on the list of most influential people in Swedish med tech industry in 2018, and most recently held a speech at TEDx Sarajevo titled "Your Trauma is Your Superpower." Without further ado, I am absolutely pleased to introduce you to Fabian Bolin. Fabian, welcome to the virtual ChangeNOW stage.
So much, and thank you for that lovely introduction, Martina. Right, so as mentioned, I'm the CEO and co-founder of War on Cancer. We're here to radically improve the mental health of everybody affected by cancer. And our product is the War on Cancer app. It's a digital support tool for people living with and beyond cancer. Today, the War on Cancer app has members from more than 20 countries. sharing their experiences of life with cancer, making it one of the world's largest social cancer apps. And as Martina briefly mentioned, this journey of war on cancer started with a personal experience, and we'll have to wind the clock back almost 6 years now. I was living in London at the time, and it was my 5th year in the city. I'd come there first to work in investment banking, but after a couple of years of doing that, I decided to make a massive career change into a new one within the film industry. Quite ironically, or back then, I thought I had a passion for the art, and even though my mother and father used to work in the creative arts, my mother used to work at the theater, and my dad was an opera singer. I ironically never had went to see a single play or opera, so there's something else lurking there, and I know by now that it was more a need for me to be seen than anything else. And I was working away in this new field of mine with everything that comes with it, castings, different acting gigs, and was on my way to progress the career and move over to the States to continue my career over there. That's when I noticed a physical change. So this was in May 2015. And initially, I thought it was related to stress and a lot of hard work, and just didn't do anything about it. But instinctively, I felt that I needed a break from London. So I booked a flight to Stockholm to visit my parents over the summer, and I kind of feel that, okay, I need some rest. Now, during this month leading up to the flight back home, this tiredness just kept growing, and I started aching all over my body and sweating regularly. And on the day that I was going to fly back to Stockholm, I worked with this massive pain in my chest area, which really made it hard for me to breathe. And now I'm worried, but when I see my excited parents waiting for me, I decide not to say anything because I don't want to worry them. And we go out for dinner, and I'm in this weird state where a couple of hours into that dinner, I have to utter the words that I should have uttered many, many years ago, which is, I can't breathe. So we rush to the hospital, and I'm scanned, and 2 days later, I'm diagnosed with blood cancer. I don't think anybody can prepare for hearing your death sentence, because that's what I felt about it. And I think everybody reacts differently. For me, a tranquility arose, almost like a peaceful kind of, almost like a voice saying, you don't have to fight anymore, you don't have to run anymore, and definitely not have to chase anymore. You can just sit back now and relax. And I pondered a lot over this feeling of mine, and I know now that before I was diagnosed, I was not a happy person at all. In fact, I was deeply unhappy because I was never able to be my authentic self. I didn't know who I was. So I think that feeling of mine was almost like a welcoming of not wanting to live anymore. But moments later, I'm rocked out of this peaceful environment and back into reality when the doctors tell me that I'm looking at a 60% chance of surviving because I'm going to go into a clinical trial, but also that I have to go through over 900 days of chemotherapy. I couldn't grasp what I heard. 900 days, almost more than 2.5 years. That was more traumatizing than hearing about the cancer in the first place, because for me, my life was basically only connected to my career, and knowing that my career was ruined felt like psychologically dying. So I panic and I need answers quickly, and I start shouting out these questions to healthcare professionals around me, and they are not so much focused on sort of the practicalities of the cancer treatment, but rather about life with cancer. I mean, what does it mean to go through cancer? What happens on a ordinary Tuesday? What do I do? Can I exercise? What should I eat? Sort of these type of more holistic questions. And when asking those questions, I first got in touch with many healthcare professionals' sort of inability to address the human needs behind the patient needs. And I was told, for instance, to eat whatever makes you happy. And frankly, you don't say that to a healthy person. So I found it really weird to hear that when I've just been received a deadly disease or news of a deadly disease. But I realized I'm not going to be able to get my answers from here. I need to take a different strategy. And my strategy became social media in the form of a post, a cry for help, where I really asked if people could help me find someone in a similar situation and share. This blog was shared almost 13,000 times over the course of 24 hours. And what followed was, for me, would change my life forever. So thousands and thousands of people from all over the world sent their love and support back to me. Loads of personal stories started pouring in, and not just from strangers, but from close friends who opened up for the first time about their experiences with cancer. Stories not only about loss, but about bravery, about sacrifice, about hope. But what I noticed above all was gratefulness from people. Almost everybody started with saying, "Thank you for sharing. I'm going through what you're going through, and just so you know, this is helping." And in that moment, something within me broke open. It felt like my heart broke open and was filled with love. And my tears started crying out of joy. And I think I cried for a longer period of time than I've ever cried before. And in that moment, I felt that I received one of my life's missions, which was to share my journey through cancer openly and fully. And I did so in the form of a blog that I named Fabian Bolin's War on Cancer. Now, this blog became my savior in that nightmare that followed. It really made me understand the power of technology, sharing, and the human connection. Why was it so good? Well, first of all, sharing was a way for me to, in real time, process what I was going through. Secondly, sharing helped me to normalize the situation around me so that my friends and my family got a much more casual understanding of life with cancer. And instead of treating me like a victim, which is one of the most problematic aspects of going through cancer, they understood that Fabian just needed to be treated like Fabian, currently going through cancer. But the last aspect was this notion that my story was helping others. And that was what had the most profound impact on my mental health. So this blog peaked at around 200,000 readers, and I can honestly say that I've never in my life experienced a bigger sense of purpose nor meaning than when I was doing this, and I've never felt happier. So around here, something was born within me. I felt that this feeling of mine that I had, I wanted to share this with other people. I wanted to be able to make other people feel what I felt. And that sort of, and I wanted to productize my feeling and give that to other people going through cancer. And in order to understand what it was that I was feeling, I'd love to just take a step back and look at the actual definition of mental health. Let's see here if I can. I'm trying to. Let's see here. I'm trying to share or change the screens here. Doesn't seem to be working though. So I'll try and explain. Yeah, perfect. This is, yeah. So mental health in general can be broken down into three different compartments. The first one being emotional well-being, the second one being social well-being, and the third one is psychological well-being. Now, emotional well-being, briefly explained, is tied to my ability to understand my own emotions and also being able to express them. Social well-being is sort of revolves around having a social context where I can be my authentic self. And psychological well-being is very much connected to having a sense of purpose and meaning. So everything you feel with regards to mental health will fall into one of these categories. Now, how do we apply this to a cancer story? Well, to do that, let's look at the typical sort of problems when it comes to mental health that many patients experience. As you can see here, these are some of the main sort of problems of going through cancer from a mental health point of view. We have clinical depression, PTSD, we have social isolation and loss of identity. How do these fit into the map I just showed you? Well, PTSD and clinical depression, they fall under the category of emotional health or emotional well-being. What usually pre-runs a depression or PTSD is a trauma. Social isolation falls under the category of social well-being, and loss of identity falls under the category of psychological health. Now, if you were to describe what it is that a patient needs to actually do in order to increase emotional health, psychological health, and social health, it's the following. For emotional health, it is to take control. The more we can get a patient to feel like it's taking control, the better the emotional health. When it comes to social health, it is connect and belong. By feeling the sense of connection and belongingness, we increase our social health. And for psychological health, it is to rebuild and find purpose. So that is how, based on these three, we have constructed the value proposition of the War on Cancer app. As mentioned, first to the left, we have the ability to connect and belong. And in essence, the War on Cancer app is a social app where you can engage, find others, connect with others, share in DMs and comments, and share your journey and experiences and ask questions. The second aspect is the ability to take control. And we have partnered with several professionals sending out validated resources, articles about things such as ways to handle stress, meditation, coping with trauma, or in this example, steps towards cultivating inner peace. Now, the last bit is to rebuild and find purpose. And usually the way to find a purpose is by helping others. Now, War on Cancer has developed a unique feature in the app, which enables our members to, if they want to, and only ever if they want to share their insights and learnings with the life science sector, meaning cancer research and cancer healthcare. Now, today, the life science sector is massive around cancer. There's so many different parts or sectors working around the cancer patients. The problem is that almost none of them, including healthcare, actually knows what a patient experiences, such as perceived quality of care, stress levels, mental health levels, how I fare with my treatment, and even less so after I'm diagnosed. Nobody had ever asked me, how are you doing right now? Now, because of the fact that we have a community where we can showcase transparently how they, by helping others and by answering these surveys, will hopefully be able to find a bigger sense of purpose and meaning in their own experience. We can use this data sharing as a tool to increase mental health. So ultimately, what War on Cancer does, besides increasing the mental health and well-being of people affected by cancer, is that we are working towards bridging the gap between patients and cancer research and cancer care. Now, I want to leave you with something else, because War on Cancer, I hope and I feel, represents more than just a technological platform. War on Cancer represents a feeling where people affected by cancer do no longer have to feel like victims, but rather they can feel like heroes again. Right. Thank you, everybody, for listening.
And thank you, Fabian, so much for taking the time to tell us about the incredible work that you're doing to make a cancer diagnosis feel more human, more connective. Like you said, you know, you were Fabian going through a cancer experience. You're still Fabian at the end of the day as you're going through all of this. And I think it's incredible how your work allows people to see a fuller picture, to be the heroes in their own stories if they so choose. And that for me is a story of hope and positivity that I'm so grateful you could share with our audience today. So thank you so much for being with us.
Thank you.
Thank you. So next we're going to move into our panel discussion portion of our session. So what we're going to be doing is bringing in two speakers and shifting gears a little bit here from the diagnosis part of this, the full story, I would say, of cancer and the mental health journey, to really zooming in on the diagnosis part of cancer. So we really have a great opportunity here to hear from two experts on the cutting edge of early cancer detection. One is working in high tech. The other one has a more hands-on approach. So joining us today, we've got two incredible doctors. One is Dr. Bhavagaya Bakshi. The other is Dr. Frank Hoffman. Now, Dr. Bakshi is an Obama Foundation leader and the CEO and founder of See the Signs. See the Signs is an award-winning platform that uses artificial intelligence to identify patients most at risk of having cancer and identifying it at the earliest possible stage. Now, Dr. Bakshi founded See the Signs after having lost a patient to late-stage cancer that could have been detected, potentially treated as well. Her mission now is to create a future where every single patient survives cancer. And she's surely on her way, because now her award-winning platform, her and her team's award-winning platform, is being used all across the NHS, which is the United Kingdom's main healthcare system. So thank you for being with us today, Dr. Bakshi. I will also introduce our second speaker. So our second speaker is Dr. Frank Hoffman. He is an Ashoka Fellow, as well as CEO and founder of Discovering Hands. Now, this project is truly unique. I've never heard of anything like this. It's a project which uses the superior tactile perception, pardon me, I'm stumbling over my words here, superior tactile perception of blind and visually impaired persons to improve rates of early cancer detection, especially in breast cancer patients. So I really want to thank Dr. Hoffman and Dr. Bakshi for being with us here today to discuss this really important work in what ChangeNOW is calling the next health crisis. So I want to welcome both of you to the stage today, and I'd love for each of you to individually give us a little bit of a rundown of what it is that you're doing, what the work is that you do, and why you perceive it to be so innovative in the space that you're in. Dr. Bakshi, can we start with you perhaps?
Thank you, and thank you for the introduction and for having me. So cancer is the second leading cause of death worldwide, and we know that early cancer detection is the single biggest predictor for survival for patients with a cancer diagnosis, but also has a humongous impact on cost of diagnosis and treatment for these patients as well. Yet, despite this, in the Western world, over 50% of patients are still being diagnosed in the late stages of the disease. And in the global South and Southeast Asia, this can be up to 70 to 80% of patients being diagnosed in late stages. When diagnosed late, less than 35% of patients will survive to 5 years. Yet if they're diagnosed early, over 80% will survive 10 years or more from their cancer. So it can be monumental in the difference between life and death if a patient is diagnosed in the early stages. What we recognized at See the Signs is that actually much of recognition of the earlier signs and symptoms is still being done by either patients or doctors. And because cancer is such a vast disease of over 200 different types, and the earlier symptoms are often vague and non-specific, this can make it exceptionally difficult to identify cancer at the earlier stages, especially as, unlike any other disease, cancer can present anywhere in the body at any time with any combination of symptoms, making it exceptionally difficult for a healthcare professional or a patient. What we do is take vast amount of data using artificial intelligence to essentially digitally screen patients using things like signs, symptoms, risk factors, demographic data, family history data, every single data that might shift that person's risk of getting cancer slightly higher, and being able to identify which tumor type the patient's at risk of, and then what the most appropriate test is to essentially either rule in or rule out cancer at the earlier stages. And taking this approach, we feel we can have a really scalable approach to thinking about cancer in a completely different way, where we can shift the narrative to survival and hope rather than the fear that currently dictates a lot of people when they think about the word cancer.
Thank you. And Dr. Hoffman, can you tell us a little bit about your initiative and the impact that it's making?
Well, as you already said, Discovery is training the superior sense of touch of blind and visually impaired women to improve the quality of breast cancer early detection. After a 10-month qualifying training, they do the physical examination of the female breast under the supervision of medical doctors in medical offices and hospitals in the best possible way. MTEs and doctors always work as a perfect team. MTEs do what they can do best, the examination, but the doctors give the final diagnosis, but now on a much safer decision-making basis. And the truly innovative aspects of this model are, first, breast cancer is comparatively harmless as long as it is only localized in the breast. It hasn't yet spread its cells into the body via the lymph and blood vessels, as you already mentioned, Bhavagaya. The chance to survive breast cancer increases dramatically if the tumor is found in its earliest stage, which means in the smallest size of the lump inside of the breast. You have to know that the standard examination procedure doctors like me are doing spends maybe 1 or 2 minutes on this examination. And it finds average tumor sizes between 1 and 2 centimeters. MTEs, medical tactile examiners, as we call our trained blind women, spend 30 to 50 minutes on this examination, and they are able to detect tumor sizes between 6 and 8 millimeters. And you can imagine that that makes really a big difference. And that means as well that the special capabilities of these blind women are life-saving. According to the data from the University of Erlangen, one of the largest German cancer research centers, the sensitivity for the detection of tumor sizes and tumor characteristics we want to find by rates 4 and 5 tumors increases by a good 20% if MTEs are involved in the diagnostic process. And that really saves lives. Second, Discovery hence opens a completely new field of employment for blind people, not despite of their disabilities, but because of their tactile talents, which they offer for the benefit of our societies. They generate more breast cancer survivors, less treatment costs, maybe up to 57,000 euro per case, and less need for social benefits because MTEs return to the first labor market where they gain their own money with their own hands, with the work of their own hands. A study by McKinsey and Ashoka said that Germany could generate savings between 80 and 160 million euro per year by using the Discovery Hands model across the country.
That's absolutely incredible. And it's amazing to see as well how both of your work, clearly the focus is early diagnosis, finding cancer as early as possible so that treatment can happen, so that there can be life beyond cancer. And Dr. Hoffman, you already started to speak to this a little bit, right? There's the impact that your work is doing directly, which is around diagnosis and early detection. But as you pointed out as well, there's an economic impact and a serious social impact to the work that you're both doing. I'd be curious if you could elaborate, and maybe we'll start with you, Dr. Bakshi, as Dr. Hoffman already gave us a little bit here. But if you can elaborate on the greater impact of the work that you do beyond the diagnosis. Can you tell us more about that?
Yeah, absolutely. So in the early stages of the disease, when, as Dr. Hoffman said, the disease is confined and very small and localized, actually about 70% of patients will just need surgery as the first mainstay of treatment. And as you may know, with surgery, you go in, you have the surgical procedure, you might be in hospital for about 3 to 5 days, you'll come home, and actually you can return to work within a few weeks. So especially if you're the sole breadwinner of a family, especially in some areas of the country where you don't have sick leave and benefits and things like that, that can be monumental, the impact it has on your family and the community around you. Whereas in the late stages of the disease, actually over 40% of patients will only have chemotherapy as an option to them. We know chemotherapy with the regimes can often be, months and months worth of quite grueling treatment, which requires recurrent hospital attendances, which means people are out of work and actually physically won't be able to work because of the toxicity and the side effects, which can be quite challenging. But also there's a huge cost barrier. So in countries that don't have a state-based system where chemotherapy costs are covered, you will then find that actually cancer treatment is one of the highest reasons for, out-of-pocket expenses, for bankruptcy. But also we find that there are many countries, even in the US as developed nations, where people will start rationing their chemotherapy because they just simply can't afford it. And with countries like, in Southeast Asia, where actually the cost is so exponential, it can actually limit the accessibility to say, actually, can you even access treatment because cost is such a barrier to essentially accessing those types of treatment regimes. So one of the key things we're looking at is not only the quality of life improvements by having surgery and not the toxic side effects and being able to return to work, which is great for the economy. We also know that cancer is one of the leading causes globally of premature death. So again, getting people out of work, out of the economy, not contributing. So it's good for government, it's good for healthcare systems, and it's good for the patient from an economic standpoint for all those reasons.
Yeah, it almost sounds to me like there's no reason not to have something like this in existence, right? Dr. Hoffman, is there anything that you'd like to add in terms of sort of the overall impact, noting, of course, that you already gave us a few notes there?
Of course, the idea of discoverance is simple and convincing. That's why it's perhaps so powerful. Consider what positive social impact the work of discoverance would have in a country like India, where the average size of a newly diagnosed breast cancer tumor is 5 centimeters, very, very big and late stage, and where the overwhelming majority of blind people lives unemployed and in poverty. So we bring two problems together and we have one solution for it. When I look at myself, I have to say that when I came up with the idea of discovering hands, at that time I never would have expected its opportunities and dimensions, but I immediately knew that I had to bring it into life. But during the project, I saw how many of my patients were happy with this attentive and focused examination in a very relaxed atmosphere MTEs are able to deliver. The Erlangen study on the benefits of the tactile breast examination showed that 97.6% of the study participants would recommend this examination to family and friends. And this is exactly the reason why there are many women now who, after years of abstinence, start to proactively take care of the breast health again. It is this human touch MTE can offer that patients often miss in our healthcare structures. This is exactly what Fabian already mentioned. Nobody asked him how he felt, but MTEs do exactly that. And I experienced what the perception of their special talents meant to MTEs themselves. After a period of renunciation and exclusion, after a time of underestimation, you are blind, so you are something what? They were suddenly highly appreciated and perceived as tactile experts because they can do something what sighted people cannot do. And this changes the world for the better, for breast cancer patients, for people with visual impairments, and ultimately for our societies as a whole, because we are changing our view on disability. And it works all over the world because blindness and breast cancer are global phenomena.
Yeah, I think it's truly special to see initiatives that are, so holistic in nature. When the subject of cancer comes up, sometimes people think, oh, that's cancer, that's not about me, that's about somebody else someday maybe getting cancer. And actually, statistically speaking, I think, and you'll both nod yes if you agree with this statistic, I think 1 in 2 people in their lifetime are likely to get a cancer diagnosis, which I think would then mean that about 100% of us are likely to know somebody with a cancer diagnosis. So this is something that affects the world on a global scale when you really think about it. The fact that your initiatives help at so many different levels as well makes it clearly something that I would like to see, more focused on in the future. And I'm curious, with just a few minutes left here on our panel discussion, do you have a sort of a hope, an aspiration, something that you would like to see changed as a result of your work? Maybe a call to action for the audience, something that we can do to create change now in relation to cancer detection and really cancer as a general subject. Dr. Bakshi, would you like to go first?
Yeah, sure. So I guess first and foremost, it needs to start with the government. So early cancer detection needs to be a core part of government policy, where there is an investment into saying, actually, we need to be detecting patients at the earlier stages of the disease and providing comprehensive care for things like screening, prevention, lifestyle behavioral modification, but also fast tracking patients who are at risk at the earlier stages. As Dr. Hoffman alluded to with the work he's doing, actually, a 2-month delay in someone being recognized for their breast cancer can actually lead from an early stage disease to a late stage disease, from cure to palliation. So time is such a crucial factor, which can only be done by having that comprehensive healthcare system and access there fundamentally. And then from an audience perspective and a patient perspective, the pandemic has had a catastrophic impact to, late presentations and late diagnoses. So I would urge anyone, any persistent or unexplained symptoms, anything that's new or changing, do consider going to see your doctor or encouraging a family member to go see your doctor to get those symptoms looked at. Often the early stages of cancer aren't debilitating. They're vague, they're non-specific, they're unexplainable, but they don't really cause much harm. So rather than ignoring it, do go see your healthcare professional and get seen for those symptoms, especially if it's the case that you do have cancer. We can then have a really positive outcome for it to be treated and cured for you.
Thank you. And Dr. Hoffman, will wrap up with you. What would be your call to action here?
Well, Discovery Hands has trained now around 100 MTEs around the world in 6 countries, most of them in Germany, where we have already shown its effectiveness, the self-sustainability, and the future viability of the model. Now we are faced with the important task of professionalizing the international scaling of our model. Our international team has started its work at the beginning of this year, and now we need 160,000 euro from philanthropic supporters to fund the work of this team until the end of next year, to make it ready for impact investments. We hold in our hands 3 important success factors. We have an extensive know-how documentation, we have convincing scientific data, and the first partner networks from our pilot phases in India, in Nepal, in Mexico, in Colombia, and in Austria. So, guys, when you are listening to this and you are able and willing to become a relevant part of our story, your support is highly appreciated and will open the door to improve breast cancer early detection dramatically in many countries of the world in a simple, understandable, and deeply human way. Just join in. Thank you.
Thank you. I think that's a beautiful place to end our panel discussion today. Knowing that this work is out there in the world, I know gives me a lot of hope, and seeing this work grow is definitely something that I want to see in our lifetime and beyond. So thank you so much to both of you for having the courage, the audacity, the strength, and the persistence to keep these projects going, to have started it off, and to be impacting so many lives is truly, truly incredible. Thank you for your time. And hopefully we will see you again very soon.
Face to face next year.
Yes, ideally, right? Take care.
Thank you.
All right, so next we have the true opportunity and privilege to have a fireside style chat with Patricia Blanc. Now, Patricia is somebody that I had the opportunity to have an in-depth discussion with at length before our session today. And I think you'll see very quickly why she is such a remarkable person. After a diagnosis for her daughter, after her daughter was diagnosed with cancer at a young age, Patricia turned her life around completely. She went from being high up in the financial sector in New York to starting a not-for-profit foundation called Imagine for Margo. And it is an organization that is focused on childhood cancer. Now, I will let Patricia tell you all of the details of why that's so significant. But what you need to know about her before she joins us here on our virtual stage is that now Imagine for Margo is the leading parents organization for fighting cancer in France. And since its inception, Patricia and her team's work has positively impacted patients and their parents at a massive scale. So much so that Patricia was deemed Vanity Fair's 50 most influential French people in the world. Her work is revolutionizing how treatment for children with cancer is done. And she's also been awarded the National Order of Merit by the French Ministry of Health. Incredible work, as you can see. And what I'd love to do is welcome Patricia here today and hear really more about her and her story. So Patricia, welcome to the ChangeNOW virtual, the ChangeNOW virtual stage. It's wonderful to have you here today.
Good afternoon, Martina. Thank you for having me and for your kind introduction.
It is my pleasure, and I hope I did you some justice with my introduction. I know you've got a lot of awards under your belt and you've done really impressive work. What I'd love to hear, because this is, a fireside chat, something that's meant to be a little bit more on the personal side, I know that you have a remarkable story of how you got to the point where you created Imagine for Margo. Would you share a little bit about that story with us today?
Yes, sure. Well, Martina, I had a beautiful life, a loving husband, 2 lovely daughters, a great job in finance. I work in Paris, I work in South Africa, I worked 7 years in New York City. It was clearly a simple, beautiful, and happy family. And suddenly, my older daughter, Margo, she was diagnosed with a brain tumor at the age of 14. She first started to have strong headaches and vomiting. So I took her to the doctor, and then, it got worsened. So I went to the hospital. And when I arrived at the hospital, after she see 1, 2, 3 doctors, while she was having a scan, I really felt that something was going very wrong. So I don't know if it is a maternal instinct, but I really felt that bad news were on the way. So yes, actually the doctor came and he told me, he looked at me and he said, well, we know why your daughter has headaches. She has a brain tumor. The ambulance is waiting for you and you need to go to the Necker hospital in Paris for more exam. So in 5 days, my life changed completely and it changed forever. Like something you can never imagine. And the diagnosis was even more devastating when we learned it was an aggressive brain tumor with no curable treatment, no clinical trial, no possibility to cure my daughter.
Patricia, I can only imagine how difficult it would be to take in all of that information, to have, you know, someone that you love so dearly being diagnosed in this way. What kind of treatment did she ultimately receive? How did things go on from there?
Well, actually, that's the point. She received an oral chemotherapy developed for adults, not even authorized for children. Can you believe this? You know, she had 40 years old chemotherapy and nothing new, no innovative treatment because she was a child. Because you know what? Many drugs are developed for adults cancer, but very few for children with cancer. So you would think maybe children are your priority, but they are not at all. Because childhood cancer is not economically viable. So the drugs are developed for adults, and there's much more adults diagnosed with cancer than children. So doctors, they have to adapt the dose to the children. But children are not like miniature adults. They need to have dedicated treatment. And in addition, we don't even have many public funding. That's too little. Especially, Martina, that this is not normal. We are talking about a major societal disaster. Do you know that cancer is the first cause of death by disease for children beyond the age of 1 in Europe? It's 35,000 children diagnosed every year with cancer in Europe, and 6,000 will die. You know what it represents? It represents 200 bus crashes every year with no survivor. 200 school bus with no survivors. No one speaks about it. So that's really something we need to do something about it, and especially that there has been no progress in survival for some brain tumor. Some brain tumor have not even make any progress for decades, and they are still a death sentence, like, you know, like Margo's tumor. So that's not acceptable, and there is an urgent need to cure more and to cure better children and adolescents with cancer.
Right. It's clear. I mean, just the statistics alone are shocking at how little attention is really going to, you know, to childhood cancer. And when you see these statistics, it's unimaginable. I imagine then that this is why you came up with the organization and started your work.
Yes, yes, for sure. You know, Margo, she died after 16 months of fight against cancer. She fought like strongly and bravely, and even during her disease, she collected money for research. She collected 100,000 that we gave to a doctor who was doing research on a brain tumor. And also, she was really always looking after the others. So she left a message, a life message that inspired me every day. This message is go, fight, and win. So what else could we do? We really had to go to fight for the other families and to win towards a world where you don't have children dying of cancer anymore. So yes, after 1 year after her death, we decided to create Imagine for Margo. I quit my job and I decided to dedicate my life for children and adolescents with cancer. And with my husband, we now continue the fight with a very nice team, wonderful partners and donors. All together, we want to give hope to the families. We want to save life of other children. So Imagine for Margo has 3 missions. The first one is to accelerate research on new treatment. The second one is to raise awareness on the cause. And the third one is to increase the well-being of the children.
I love that. And, you know, you noted on this, but you came from the financial world. This is, you know, you did not start off as a doctor or even in this sphere. So it's quite a big leap from that space to the space that you're in now. And yet, you know, when the message is, you know, go and fight and win, I can imagine how somebody from the financial sector, some place that's quite competitive, can go out there and achieve some really amazing things, you know, with this new skill set under your belt and an amazing team. So I'm curious, can you tell us a little bit about the successes that you have had, you and your team have had to date with Imagine for Margo?
Yeah, sure. So you're right, I started in finance and I didn't know nothing about cancer. I didn't know nothing about research. So I had to learn. So I went to countless conferences. I spoke with pharma industry. I spoke with clinicians, academics, with politicians, with investors, you know, parents' organization. I wanted to understand this new world. I wanted to understand the challenges, the problems, the miscommunication, the barriers. So I tried to really see what is happening and speaking with everyone. So that's why 10 years ago, after 10 years, Imagine for Margo quickly became actually the first parents organization in France to finance pediatric cancer. We gave 12 million euros to research. We started like 29 new programs to give access to new treatment. And you know, from the beginning, we wanted to think big. We wanted to think differently. And this is why we started a partnership with ITCC. ITCC is 80 research center and research laboratory in Europe. And the program that we financed from ITCC had a major impact. Actually, it gave access to precision medicine for children in Europe. I want to give you two examples, Martina. The first one is the eSmart program. eSmart is the unique in the world platform trail where in one program you have 10 different types of treatment for all kinds of tumor and with treatment coming from different pharma. And there are many molecules, new molecules. So this is a real booster of innovation. The second example I can give you about the impact is the MAPIAC program that we finance. This is about understand cancer, like deeply analyze the tumor, the whole genome of the tumor, looking at the anomaly, what is going wrong. Can we find a target that we can match with the best treatment? And possibly the one from eSmart. This is precision medicine. So that's the two examples. And now, you know, this approach is continuing under the France Medicine Genomic Program. And by the end of 2021, at the end of this year, many children will have access to molecular profiling of their tumor, not only at diagnosis, but also at relapse. So this is also a huge amount of data that will help to make discovery.
Yeah, it's undoubtable that, you know, that the work of your team and especially the way that you approach your work is going to make, you know, detection, treatment, everything along the lines more possible and likely for children with cancer, and make it in some ways, you know, easier for families like yours that have gone through this whole journey, this roller coaster in many ways, to, you know, to go through life in a meaningful way. Now, I'm curious, as our time is running out here, I'd love to know what's next. What would you really like to see as the next sort of big change in this space? Yeah, what's your hope for the future here?
Well, I think we first now we have built the foundation for a new future. And I would think that we have now three steps for three next steps for the future. So that will be precision medicine is there, but we need much more new drugs. That's the first point. The second point is that now we also have a big amount of data, and those data, they need to be urgently shared and analyzed so that we understand better why children have cancer and how, why they resist to treatment. So that's the second thing. The third thing is that, recently there has been, and we worked a lot on this as advocacy part, is that we have a new cancer plan in France, a 10-year strategy, where we have some dedicated action for the children. And there's also the first cancer plan in Europe with a dedicated initiative for childhood cancer. This is great. This is a good opportunity, but this needs to happen. So we need to have the concrete action and the budget that match ambitions. So that will be, the third, I think, step for me. So more drugs, more analysis of data, and more funding.
Yeah, it sounds like overall more focus on childhood cancer. I mean, this is something that is affecting so many children. It's got to be focused on. Thank you so much, Patricia, for sharing your story, your initiative with us today. This has been truly inspiring, and I'm so glad that the ChangeNOW audience has had a chance to hear from you and all that you do. Take care.
Thank you, Martina. Bye.
Thank you. Bye. All right. So that is concluding our session today on the next health crisis, cancer. As we heard here today, cancer is not something that is, happening in some distant land, something that will happen sometime to someone somewhere. The statistics show that the chances of cancer touching our lives personally, whether it's through our own diagnosis or through the diagnosis of somebody we know, somebody that we love, it's actually quite high. It's 100% that we will know someone who is diagnosed with cancer. Yet, it's important to know that this diagnosis or this closeness and proximity to cancer doesn't have to spell stress and catastrophe thinking. It doesn't have to equal fear for many people. Through all these innovations and approaches that we've heard about here today, we can see that cancer can be approached with optimism and persistence, that we can look forward to seeing changes made in the scope of research and detection, treatment, prevention, and that storytelling plays a really important role in all of this. Cancer can be something that is less scary and better understood, and we can build community around this topic that doesn't have to be so taboo. So I hope that today you've enjoyed hearing from our speakers, that you've been touched, that you've been inspired, that you've maybe learned something that you didn't know before about cancer, and that maybe, just maybe, you will make some sort of a change in your life around how you feel, how you think, or what you do in relation to this very important subject matter. I thank you very much for joining us today, and I hope very much that I will see you next year live in person at ChangeNOW in Paris. Take care.